On March 5, 2020, the Faculty of Medical Sciences Teaching and Research Complex, the UWI Mona campus, held a conference entitled COVID-19 Pandemic Preparedness. Speaking on personal preparedness is Professor Wendel Abel.
Good evening, everyone. And the room is silent. And I am wondering, is it spelling doom or gloom? But let's pause. I want you to look to the right, everybody, and look to your left. Because based on the data, 2 out of every 3 persons will be affected. With 67,000 deaths predicted. You didn't look? And so, you know, as we talk about personal preparedness, it's not personal preparedness for funerals. In fact, what we're going to have is a discussion in terms of how to better prepare ourselves for COVID. When Prof. Christie invited me, she asked me to specifically deal with the psycho-emotional issues. And she whispered to me before I came up and she said, please give us some hope. But the dean mentioned the word benediction. And so what I'm going to share with us is personal preparedness, and specifically geared towards how we prepare ourselves, but also the individuals that we treat. Many of us are health professionals here. And first point I want to say, it's so important for us to manage our emotions, because I think for the past few weeks, I've been a bit anxious myself, a psychiatrist panicking, right? But what has helped me is the fact that as I saw the country, Ministry of Health, well, globally, regionally, nationally, the university, the faculty, proceeded through a whole series of planning. It gave me comfort and hope that we are in fact preparing ourselves. And it's important for us to recognize that fear and anxiety are normal and natural, right? It's normal and natural for us to have these emotions. Our feelings are what they are, right? But what we have to learn to do is to manage our emotions to prevent despair, panic, and counterproductive measures. And also to recognize that we have control over our reaction, because fear spreads faster than the virus. And it's important that we maintain a reasonable perspective at this time, because you know the media blow things out of proportion. Social media with the Twitter and the Facebook posts. Yesterday I think there was posting on social media that we had several cases in Jamaica. And so we're getting a lot of misleading information, and it serves to spread panic, fear, hopelessness. And so we have to be aware of the infodemic. That's a new word, yeah? And look at the newspaper headlines across the world. World War V, Corona chaos, the point of no return. And they continue. And the cartoons, and the clown. You got that one? And of course, you know, the president about 6 hours ago in an interview on Fox News discounted the WHO statistics and said that he doesn't believe that it's really 3.4% fatality rate, but that it's about 1%. Google it, you'll see it. And so it's very important for us to reframe the perspective, right? The word pandemic speaks to spread, not severity. Let's remember that. And let us not then assume that a catastrophic pandemic is at hand. At the same time, don't take the risk of infection lightly. And so it's important for us at this time to be informed, and it's important for us to rely on credible sources. So I congratulate all of us who've come out this afternoon to ensure that we're well informed, and the persons who are also online, right? And there are many credible sources that we can tap into. There's World Health PAHO sites, Ministry of Health and Wellness, the CDC, and lots other sites. So I encourage us, tap into the information. There's a wealth of information out there. And there are a number of interesting articles that have been written over the past few months. Lancet, Science, Journal of American Medical Association, Scientific American. Just Google and put COVID-19 and these will pop up, right? But keep yourselves informed. Don't need to repeat what has been said, but colleagues have been saying the global mortality rate is 3.4%, but I want us to reframe the perspective and remind ourselves that 96.6% of persons will survive. And although COVID-19 causes more severe illness than the flu, it does not spread as effectively, and that's something we need to be reminded of. So, colleagues, stop the catastrophic thinking, right? We have to be careful, inform ourselves, take precaution, but stop the catastrophic thinking, right? And again, I mean, these have been repeated, mentioned before that a number of public health interventions are in place. Widespread information campaign, and the Ministry of Health and Wellness has mounted one. A new concept is the whole idea of telecommuting, that when we have a problem, we don't have to travel physically to work or to school and so on. That's another strategy that we'll be using. Social distancing, that has been mentioned, right? But I'm going to take us to the basic, personal protection, back to the basics. That's the basics this evening, right? And just to point to us that CDC has an excellent website on personal protection in the home, school, at church, in the medical office, wherever we are, right? And I'm going to encourage us to read this extensive website with a wealth of information. But I'm just going to highlight a few things in the few minutes that I have, right? In terms of personal protection, and we've heard this before, stay home if you're sick. It's all called voluntary home quarantine, right? Practice good respiratory etiquette. Cover your cough and sneezes with tissue and dispose of tissue in bin. If no tissue, cough or sneeze in your sleeve, not in your hand. Practice good hand hygiene. Wash hands thoroughly with soap and water for at least 20 seconds. I think the Prime Minister of the UK said you can just sing happy birthday 2 times, right? Let us sing it now and you'll say how. Everybody, happy again. And you wash your hand. Very good, right? Anybody here celebrating birthday? And you continue longer, right? But we have to make it shorter enough for the presentation. So, but it's 2 seconds, right? And if you don't have soap and water, you may use alcohol-based sanitizer, about 60 to 95% alcohol. Avoid touching your eyes, nose or mouth. And while I was sitting, I kind of looked behind and looked at how many of us were touching, and I think at least at any point in time, about 20% of the room touching. Still a few of us, the public health people touching their face, you know. Right? So it's so reflex. It's easy to do, and we have to start practicing from now, right? I am struggling with it because I like to take off my glasses, right? And I probably do that 20, 30 times for the day. But we have to practice now, practice early, practice the hand washing early. And remember, we have to continue to practice good health habits. Clean and disinfect frequently used surfaces. Practice good health habits, rest. Make sure you have adequate fluids, healthy food, and you manage stress. The use of masks, I know that has come up again. But let me just remind us, it's not recommended for use by people who are not sick in home or community setting. Crucial for health workers. And also, interestingly, we sometimes forget carers in home setting and in residential settings such as nursing homes, right? So we don't have to panic and go out and buy the mask and order those on Amazon, knowing that we can't get them anymore, right? And if it is that we have to go into voluntary quarantine, remember it is unlikely to go beyond 14 days. And if one has to do that, ensure that you have adequate supply of food, for example, canned food. Treat it as if you're preparing for a hurricane, right? Make sure you have a lot of bully beef, right? And water and liquids, medicine, and regular household supplies. Yeah? So we're not saying anything new here, right? And as you plan ahead, just ensure that we stay informed. We should have emergency plan in place with our household members, relatives, and friends. Sound like we're planning for a funeral, eh? But we need to plan. Make a list of your emergency contacts, such as your healthcare providers, teachers, employers, community resources, and so on. And as said before, ensure adequate supplies. And if there's community spread, and I'm sure by then the Ministry of Health and Wellness will issue further release, so we should be guided so. We should, though, avoid contact with persons who are sick. If you are sick, stay home, avoid large events, observe family members for symptoms. That should be, for example, especially children and the elderly, set up, you may have to take decisions such as setting up separate room for household members who may have a cold or so on. And it's important that we check in with family members who live alone, especially the elderly. Avoid panic buying and hoarding, right? So those of us who've been buying the sanitizers and so on, you can stop now, right? Make sure we stock up on, don't panic buy the things such as the toilet paper and the water and hand sanitizers, yes? Just be reasonable in terms of how we go about things. But at this time, and based on the presentations we've seen before, it is so important for us to plan, and keep planning. Because in so doing, it helps us to prevent exposure, to ensure that we support our health system, and to strengthen our individual and collective coping mechanism. At this time, communication matters, right? And it's important that we acquire accurate and also pass on, disseminate accurate, simple communication, and we ensure that we minimize scare and fear. The scare and the fear will not work, it doesn't help. And so just sharing with us some simple brochures, handouts that we've developed, for example, in the Department of Community Health and Psychiatry, just to share. Just simple messaging. Wash hands frequently, cover mouth when coughing, sneeze into elbow. Don't touch your face. Stay home if you've had a bad cold or the flu. And I like this one, which was adapted from the National Health Services in the UK. If you sneeze, you make sure you catch it, dump it, kill it. Everybody, let's repeat it. You do what? Catch it, dump it, kill it. Very good, right? And know the signs of the coronavirus. These have been discussed with us, right? And most importantly, manage your stress, right? And so before I close, I'm just going to leave you with one technique that you take home this evening to just reduce your anxiety and your panic and so on. So I want everybody to close their eyes for me. And what we're going to do is just breathe in through our nostrils and out through our mouth. Everybody, just do it gently, right? Don't touch anybody while you do that. Keep your mouth closed as you breathe. I don't know how you're going to do that, right? But just breathe in. Everybody, let's do it. We just relax ourselves, right? Because it's about just learning to manage so everybody, we breathe in gently through our nostrils, out through our mouth. Just gently. Just take your time and just breathe. And as you breathe, just focus on the air going in and just breathe in and out. Keep doing that. We're sending you off to sleep before Prof. Figaro comes on, right? But how did that feel? I'm sure you feel relaxed, right? And so let's not panic, right, in the pandemic if it happens, right? But let's keep ourselves relaxed, calm and cool. Have a wonderful evening.